All the students who are interested to becoming genetic counselor have several times asked me how to become a genetic counselor. To be a genetic counselor, you need to have profound knowledge in human genetics, different taste, being prescribed for diagnosing the diseases, human genetics, and different techniques. Those are being used in the lab to diagnose the genetic diseases. So those who want to be genetic counselor, first you need to complete your masters in a relevant subject, in which you will learn a lot regarding human diseases and genetics, human genetics as well. So after completing that, you need to do a PG diploma in genetic counseling. There are different genetic counseling courses in India available. Mainly the main one by Kamineni Hospital in Hyderabad, Vellore Institute of Technology VIT in Chennai, Kasturba Gandhi Medical College, Manipal. In all these places, PGI Chandigarh as well, you will get the PG diploma course on genetic counseling. There you will learn regarding genetic counseling, human diseases, genetic testing, about different techniques, the variant analysis and all. After that, you need to have the BGCI certification, that is Board of Genetic Counseling India. And for BGI certification, there are mainly two levels, basically level 1 and level 2, then associate, then grandfathers of human genetics, all this. So first you need to require that level 1 certificate, and for level 1 certificate you need to shadow, you need to be with a senior genetic counselor, follow them doing different genetic counseling sessions, and you need to submit cases done by you under supervision of some senior genetic counselor or clinical geneticist. After that, you will face an interview panel where a psychiatrist, a genetic counselor, a doctor, a clinician will be there, and they will ask you different questions regarding genetic testing, regarding genetic diseases, and the case you have done, which you have submitted to BGCI. Then after having level 1, you need to practice at least for 3 years under supervision of some senior clinical geneticist or senior genetic counselor. Then you will have to apply for level 2, and after completing the level 2, you will get the certification from BGCI. After that, you can practice independently. And one opinion that is from my viewpoint, my personal viewpoint, I am telling you, genetic counseling is now at a cutting edge and it's evolving a lot. So you need to have profound knowledge of genetics, pedigree analysis, all these different diseases. Like when you will be a genetic counselor, doctor will ask you, the clinician will ask you regarding all these things, the reproductive things, the fetal medicine thing, the pediatric thing, the oncology. So you need to have knowledge, clear knowledge of human genetics, basic knowledge on every these aspects of human genetics. So, and I also prefer that if you have a research experience, because different tastes, different techniques which are being used, when you have to recommend that genetic testing to your patient, after that when the report will come, like in that I say to everyone, like when a USG report is coming to a gynecologist or a X-ray report is coming, then whether they directly see the report or they see the plates and they analyze it by themselves, you need to have that knowledge also. So when a karyotype report is coming to you, you need to have a good knowledge of the banding pattern of the chromosomes. So you can by yourself also do the reporting. You need to have cytogenetic knowledge at that level. And in case of exome sequencing, CMA analysis, you need to know the techniques. When an NIPT report is coming to you, if you don't know the why they have reported the Z score like that, you need to know all the basics that I prefer. when they have just reported a variant as a variant of uncertain significance. Then you need to have the variant analyzing knowledge. When they have classified a variant and they have written like that PM1, PM2, so you need to have the nomenclature and how the SEMG classification being happen. So you need to have a clear knowledge of the diagnostic techniques which are being used in the lab. So lab exposure, a good lab exposure, like who are having PhD regarding different human diseases, I also prefer that they will get a good start in their career in genetic counseling. It's not essential for having genetic counseling diploma. It's not essential that you need to have a PhD in human genetics, you need to have a postdoctoral experience and all. The basic thing that you need is a master degree in a biology, physiology courses where human genetics was there in your degree, in your syllabus. That is the primary essential thing. But if you have a research exposure, if you have a PhD in human genetics, as I myself have done my PhD working on ADHD, attention and deficit hyperactivity disease, so I can say from my own experience that it helps me a lot. So those who are having research experience and they want to come in genetic counseling, I welcome them. And those who are just doing their masters, I also will tell them that just learn about these things well and acquire your degree and come to genetic counseling. We need a lot of genetic counselor in our country. Thank you.